Health pioneers present know when it's a heart attack, 10 heart attack symptoms plus 7 tips to help recovery. If you are new to this channel, please subscribe and hit the notification bell for more topics on health. Dramatically clutching the chest and slowly sinking to the floor is often how heart attacks are presented in television and movies. And while heart attack symptoms can arise suddenly and be quite intense, more often the symptoms start more slowly and are milder, according to the American Heart Association. Heart attack symptoms can present with a general discomfort, pressure, fullness, squeezing or pain in the central part of the chest lasting for several minutes. Additionally, symptoms may occur in other areas of the body, too, including one or both arms, in the back or neck, stomach or even the jaw. Someone having a heart attack may also feel nauseous, be lightheaded, or they may break out in a cold sweat. Heart attack symptoms in men often differ from heart attack symptoms in women. The American Heart Association says that shortness of breath, nausea or vomiting, and back or jaw pain are symptoms that are more common in women than in men. If you are experiencing any of these symptoms, please call 911 immediately. The quicker you are seen by emergency responders, the sooner treatment can begin. What is a heart attack? According to the American Heart Association, coronary heart disease, including heart attacks, is responsible for causing 1 out of every 7 deaths in the United States. So, what is a heart attack? It is an event where the flow of oxygen-rich blood is limited or cut off before it reaches the heart. Coronary arteries narrowed because of plaque buildup, atherosclerosis, are often the culprit. When plaque particulates come loose and break off, blood forms around them, causing a clot. This clot can then block the blood flow completely, leading to ischemia. Signs and symptoms. The type and severity of heart attack symptoms vary from person to person, and by gender. The following symptoms are common, but it is important to understand that the more of the symptoms you have concurrently, the greater the possibility is that you are having a heart attack. Pressure, tightness, pain, aching or squeezing sensation in the chest that may radiate to the neck, jaw or back. Nausea. Indigestion. Heartburn. Abdominal pain. Shortness of breath. Cold sweats. Fatigue. Lightheadedness. Sudden dizziness. Heart disease is the #1 killer of women in the United States. Heart attack symptoms in women may be more subtle, and many women report they believed the symptoms were due to aging, acid reflux or even the flu. According to the Cleveland Clinic, pre-heart attack symptoms in females may include sad face, 6. Unusual fatigue. Sweating and shortness of breath. Pain that radiates from the chest to the jaw, back or neck. For women, it can sometimes be difficult to tell the difference between women's heart attack symptoms versus anxiety or panic attack symptoms. These two conditions can present very similarly, with symptoms including vertigo, dizziness, heart palpitations, numbness in the extremities, trembling and even fainting. If you have a history of heart disease or heart attacks, and you also have an anxiety or panic disorder, anytime you experience any heart attack symptoms, you should seek emergency medical attention. Symptoms of a heart attack in men under 40 include many of the common symptoms mentioned above. The real challenge for this demographic is that seemingly healthy young men can experience a sudden cardiac event or SCE. We often see this in young athletes when the subtle symptoms are brushed off as overexertion. Early warning signs. According to the Mayo Clinic, some people may experience early warning signs in the weeks, days or hours in advance of a heart attack, and they note particularly that recurrent chest pain, or angina, that is triggered by exertion and relieved by rest may be the earliest warning sign. Talk to your doctor as soon as possible if you experience chest pains.